The following is a paid program. Advice and opinions expressed during the program are solely that of Generations Chiropractic of Wisconsin, not WBEV or Good Karma Brands.
And welcome into Taking Care of Business. Today's show, we are featuring Generations Chiropractic of Wisconsin. And here with me today, I have Dr. Ellie Kinsey. And we could call her Elizabeth, but we'll find out why we don't here in just a few minutes. First and foremost, good morning. Welcome to the show.
Yes, thank you for having me. I'm excited to be here.
Now, you've kind of been here before, not in this capacity on this show, but you were kind of here as part of like a chamber spotlight at one point.
Yeah, so, and that was actually at my 1 year anniversary of having the clinic. It was like the next day was going to be the 1 year anniversary. So just a little bit of getting to know, hey, what's going on with the radio and opportunity to get more involved with the community. So.
And now you're back here again, putting that wonderful smile of yours on video, and we're going to talk more about everything that Generations Chiropractic has going on. Before we dive into the business side of things, though, let's talk a little bit more about who you are. Now, we had a nice little conversation before the show started about how your actual first name is Elizabeth.
It is.
But you go by Ellie, Dr. Ellie,
Yes.
specifically more often than not. Tell us a little bit about that. Tell us a little bit about you, your background, your ties to the community, all of that.
Yeah, so it's kind of interesting. Growing up, I was always Elizabeth. The irony is my parents were like, my dad wanted Elizabeth, my mom wanted Bethany. It's like, oh, either way, we'll call her Beth growing up. But I never shortened it, anything like that. Okay. Until I get to be about, mid-20s, that kind of thing, and out in the profession after I graduate chiropractic school. And now it's like, my specialty, we'll get more into it later on, is taking care of babies, kiddos, toddlers, pregnant mamas. A toddler can't say Elizabeth. That is way too long.
Right.
So how do you go about renaming someone in their mid-20s? Like, it just doesn't seem like a normal day-to-day thing.
Right.
So it took a long time to figure out, like, Dr. Liz, Dr. Beth, and anyway, we just came up with Dr. Ellie. I feel like it fits really well. The kids love it. It's fun way to go about things. It's weird for me though if someone's like ever trying to refer to me as just Ellie. I'm like, without the doctor in front of it, like it just doesn't click. And
right, you're not paying attention. They're saying it over and over behind you. No clue.
Yeah, and it's also kind of like, okay, if you try to put doctor in front of Elizabeth, like, okay, kind of tunes things out too. It also makes it very helpful if I'm ever out in the community and, someone refers to me as one name or the other, I'm like, okay, maybe a hint of how I should remember you if I don't know exactly who you are.
There you go. I like that. I wish I had something like that. That's nice. That's nice.
Little tidbit of, what insight should I know or not know about this person?
Now, your Generations Chiropractic Clinic is here in Beaver Dam.
Correct, yeah.
Are you from Beaver Dam? Are you from the area?
Yes and no. So me officially no, but my dad was born and raised here in the area. So definitely have had family ties. Like even right now I'm living in my grandma's house. So that's an interesting story how that came about. But I was born and raised in Manitowoc, Wisconsin, and then went to undergrad in Illinois, and then chiropractic school was in Iowa. And then my first position outside of chiropractic school was in Northwest Wisconsin. Then I was in the Twin Cities. And then I ended up coming back here to Beaver Dam, and I had done a whole lot of coverage work and was working in different places, like commuting to Madison, commuting to Green Bay, Milwaukee stuff. And I was like, okay. So lots of just interesting pieces of how I ended up here. But it was really nice to, hey, I came back into this community when my grandma moved into assisted living. So I didn't know where I was going in life at that time. And I'm like, well, I can help out the family, and it's a little bit of a landing ground and not immediately, in my parents' backyard. So a little bit of nice distance there. And I mean, I've known the house that I'm currently living in since I was a little girl. Like, that's literally where my dad lived since he was 5 years old.
Right. And it's not like Manitowoc is, hours and hours away, really.
Oh, yeah.
So, I mean, it's not like it's too far from where you grew up. Well, obviously, we love having you here in Beaver Dam, I would assume, because I haven't heard any complaints thus far.
Oh, okay, good. Please let me know if there are any. So,
I'll let you know if anybody comes forward. But your family's ties to the area, you had said Grandma lived here, you're now living in Grandma's house, and we got some notes here, and I see some interesting facts I got to ask about this.
Yeah.
First figure skating medal here in town.
Yeah, so I grew up as a figure skater. I played tennis, I played softball. Those were my three main sports growing up. And like even my very first figure skating medal that I ever won was over at the Family Center Ice Center here in Beaver Dam.
Oh, wow.
So, again, just one of those cool things of, hey, well, I get to compete in, my grandma's hometown, and, there's an ice rink here. So that's literally where I won my very first medal. And in like the summers, I would even go to tennis camp here over at Wayland when they had Nike tennis camp.
Right.
And so instead of having to stay in the dorms, because, Sometimes non-AC in the summer it gets to be kind of less than
Right.
stellar. But I would basically go to tennis camp during the day and then stay overnight at my grandma's house. And then, she'd take me to camp in the morning. And I did many years of Nike tennis camp here, too.
It's a nice little summer way.
Oh, yeah.
Now, was it your involvement in things like the skating and the tennis that led to you being like, what, chiropractic sounds like a good idea?
Pretty much, yeah. So I obviously was very athletic growing up all the time. With that, especially primarily tennis, I had some injuries. I ended up actually playing tennis in college too. I had an athletic scholarship, so very much a part of my life for sure. And some knee injuries even led to needing surgery when I was at my senior year of high school, which was on Valentine's Day. So I'm like, easy day to remember of senior year, Valentine's Day. That's when I had knee surgery.
Exactly what you want to do on Valentine's Day, knee surgery.
Hey, I was single, it's fine, like whatever. But in that process, obviously I'd done a lot of physical therapy and was on more the rehab aspect, and I'm like, I want to play college tennis. That is my goal. Right. So I thought I was going to be a physical therapist because, again, those were the people who helped me heal into allowing me to accomplish what, at that time, my biggest dreams were to be playing college sports. And then throughout undergrad, I was like, I don't know if this quite seems right. I was, shadowing some places, and I'm like, I don't know exactly what I want to do. On a whim, I'm like, okay, looking in like different med schools, different chiropractic schools, whatever. And I'm like, okay, cool. Like, one of the chiropractic schools reached out. It's like, hey, I saw you showed some interest. Want to come visit? I'm like, sure, why not? This is the one weekend that I'm free in my tennis season. So the one weekend off, they're like, we have a big, overview weekend. I'm like, cool, why not? And then by the end of that weekend, I'm like, so I'm going here. I'm going to start in the fall. I don't know exactly why. And then it was a year into it that I had that realization in chiropractic school. I'm like, oh, now I understand what chiropractic is all about. It's so many people think it's popping and cracking the bones in the spine. We'll completely get around to debunking that at some point. But I realized, oh, there's so much more of a purpose. And then it was even like another year later in chiropractic school that I found my passion when I was on a mission trip that I'm like, I really want to serve the kids. Like, the kids are my passion.
And that's kind of an interesting thought process. We'll dig more into who your primary patients are. But like you said, people think about chiropractic, they think, popping bones, popping backs, necks going one way or the other or whatever, and that satisfying sound you get from it. But I guess they don't really think about that's something you need for kids.
Yeah, no, definitely not.
Kids are fine. They just bounce, get back up, and keep going. Apparently, they need a little more than we thought. Let's talk a little bit about the business. So, Generations Chiropractic, a little over, more than a year over now, going on 2 years that you've been open.
We're basically about a year and a half right now, yeah.
So that's really awesome. You kind of said one person team here.
Pretty much, yeah. So I do have someone who helps me out in the afternoon for a few hours a week. But yeah, basically, excuse me. I need to reiterate that I have a business partner. She has 4 legs, and she really is the one who runs the clinic. So Minnie Pearl, she actually came with the practice when I purchased an established practice here in town.
Okay.
So she was the continuity, and yes, Minnie Pearl is with me every single day in the clinic, and she is her own spunky little self.
Okay. Well, tell people a little bit more about Minnie Pearl. So Minnie Pearl is cat, dog?
Dog.
Okay.
Yes. So she's a little Shih Tzu Bichon, so a little white fluff ball, about 17 pounds. She is the cutest, sweetest, sassiest dog all wrapped into one.
Okay.
Official dog mama here, like without a doubt. Like, if you need to look up the definition of dog mama, you can just put my name right next to it.
So I'm assuming with all of the littles that come in and see you as patients, Minnie Pearl probably is the favorite of the two of you.
Oh, yeah. Even yesterday, it was a lady who had come in, and she's like, my husband won't let me have a dog. So right away calls over Minnie Pearl and starts petting the dog. Yep.
I like it.
So she is really awesome. Like, even when a toddler has crocodile tears or you get a baby who's crying, even if she's taking a nap in the other room, she comes running over and is like, why do I hear crocodile tears? What's going on? And,
Nice.
Even if baby doesn't instantly settle down, she'll start crying with the baby too.
Aww.
And I don't know. Again, I had that same breed growing up. So it was just a perfect melding of how the opportunity came into my lap of being here now in Beaver Dam. And I get my ideal dog breed with the process, too. Yeah, there was a lot to be said for I never saw myself having my own practice.
Right.
And now here I am. Okay, never saw myself living in Beaver Dam either. I have a chiropractic practice. I have a dog. I'm
I feel like there's a perfect alignment chiropractic joke somewhere in there, from the right weekend, not having to have tennis, to the school, to everything all the way through to being kind of full circle back here.
I'm really along the lines of, you got to appreciate your journey and acknowledge the steps in the process. Not everything is easy, and you don't know exactly where things are going to lead. When I came back here to Beaver Dam, I'm like, I'm going to help out with my grandma's house, and I can contribute to the family that way. To now, I basically get to step into what I love doing every single day right here in town, not having to commute half an hour, hour and a half. It was a great season of my life when I did that, and I'm excited to dive more into being a part of the Beaver Dam community.
Awesome. Well, let's let people know how they can to find you, get that information out there for anybody who's listening right now. Let's start with location.
Yeah, so we are at 105 Warren Street, so that is right across from the hospital. There's a nice complex of different buildings there in kind of a condo association. So we're in Suite 1, so we are right on the corner of Warren and Webster Street. Normally, easiest way to get a hold of us is via phone, so that would be 920-885-0641. And I'll be honest, I would rather text than call. So you might get a quicker response if you text the clinic rather than calling the clinic. And that actually normally works pretty darn well when you're a busy life. It's like, hey, I can send a text, I have this question, that kind of thing.
Right.
And I can get back sometimes sooner than, hey, let's even find a time that works for both of us to have a phone call rather than in the midst of whatever.
It doesn't make a lot of sense. Website as well?
Yeah, so that is generationschiropracticwi.com. So officially the business name is Generations Chiropractic of Wisconsin.
Right.
No one knows it as that. It's just Generations Chiropractic. And sometimes even shortened more to Generations. So
I like it. And I see a note here, people can actually go online to book appointments with you as well.
Yeah, so especially even like new patient visits, even follow-up appointments. Some people love that. Again, it's like, okay, middle of the night, something's not right. And it's like, we need to just get on with this and figure out what's going on. So people can schedule that way. If you ever need more flexibility, that's definitely better. I have more flexibility outside of what is on the online booking stuff than, what's just available there. So if you ever need something that you're like, hey, can we really figure out this time or whatever? Yeah, let's do it. Let's figure it out.
Awesome. Now, anybody who's listening right now or watching on the stream is probably going to say, boy, this voice sounds familiar. Maybe I've seen you before. If they've had anything to do with Leadership Beaver Dam recently, because you got to give a presentation there. And were you a part of the latest leadership group as well?
Yeah, so I'm in the current class right now.
Okay.
So this past Wednesday was a health and wellness day.
Perfect.
So, we always like to kind of pull on each day is kind of about a different theme. And
Right.
So this past week, it's like, hey, it was health and wellness, and we kind of like to call and pull on people in the class. So I was asked to do a presentation, and I'm like, yeah, absolutely. Like, my biggest thing about anytime I get an opportunity to speak is so much that I want people to understand that there are so many different realms of chiropractic, and that there's so many different specialties to really empower you to know what chiropractic is, and so that you can ask questions and find what is the best fit for you.
So I know I'm putting you on the spot here a little bit, but can you tell us a little bit of kind of what your presentation was? You have some points from it, or some overview topics that you discussed?
Yeah, so I can ramble forever, and
nothing wrong with that. That's
like,
radio.
I'm passionate, so it's also something I'm passionate about. I'm going to go on and on about. But really, kind of the thing is, I have a different niche of being more of a pediatric prenatal specialty. It's weird. In Wisconsin, you can't officially say you have the specialty that you're better than someone else, what, yada, yada, yada. Again, all the legal mumbo jumbo.
Right,
I don't know what all that officially is. But anyway, it's like I've done a lot of additional trainings and certifications in pediatric chiropractic, so taking care of the kiddos and the pregnant mamas. So I also wanted to basically empower people of, hey, when you are looking at different things, ask questions. There are different styles of techniques of chiropractic, like you had mentioned earlier.
Right.
Hey, you hear popping, cracking, you think someone's going to twist your neck, that kind of thing.
Right. That's what I wrote down a note here. I watch, obviously TikTok's a big thing everybody's talking about right now, but there are constant TikTok videos where it's, oh yeah, look, they wrapped a towel around their shoulder or something and pulled and yanked and did a thing, and you heard a pop, and they looked relieved afterward, I guess. So
they look relieved internally. I'm cringing during those, but it's like, chiropractic is really a very specific thing, and sometimes, again, people are like, okay, I just need to hear the pop and crack and then I'm going to feel good. And I'm like, how can we specifically look at an approach to make sure that your body is functioning at its optimal level? So sometimes you might hear a little bit more popping, clicking. Sometimes it might even be more of a fingertip type pressure, so different approach of what we would call more of a tonal approach. Or sometimes the table does the majority of the adjusting, because again, when you think of, what is it, force equals mass times acceleration.
Right.
Hey, if we add the speed of the table, that makes it seem like I have to do less work and I don't have to ever manhandle someone kind of thing.
Right.
It's like, hey, it makes my job easier. And I just want people to know that it's like, okay, if one style of chiropractic doesn't work for you, look into different approaches, because some will focus more on nutrition, some will focus more on rehab. For example, there are specialties and certifications in animal chiropractic. Like, I take Minnie Pearl to get adjusted every single week because I don't even trust myself adjusting her because, she's a dog.
Right.
So,
I guess I didn't know that existed. That's kind of cool.
yeah.
You mentioned, I want to go back a little bit. You mentioned the table. Are there specific tools and technologies and advancements in chiropractic that are specific to chiropractic?
Yeah, so I love that I have technology called the CLA Insight Scan that I actually can measure how well the body's functioning. So again, we kind of go back to the whole, I'm feeling like, dude, this just feels out of whack. I want to feel better. And feeling in pain is only 10% of what the body can do. So I, at my clinic, will measure what is happening with the other 90% through, hey, are your muscles overengaged, underengaged? Have I been sitting at a desk for eons and I just don't even know how to properly engage my core and I don't even know what that musculature is like?
Right.
Or are your blood vessels, glands, and organs just kind of going shot and not happening and unhappy there? Like, hey, I've never thought that my sinus congestion and my seasonal cold is a regular thing, that I'm working through frustrations there.
And this is scary. So is this like I'm going to be a dork here, but you pull out like a Star Trek tricorder and you just scan over them once and you're like, well, here's what's wrong.
Okay, to some extent, yes.
Really? Now I'm interested. Okay.
Yeah, to some extent, yes.
Right. Okay. Tell me about it.
So the one scan, I always like to say to kiddos, it's like a race car wheels are going up your back. So a set of race car wheels, and what this is measuring is the temperature on either side of the spine. So you want the temperature to be nice and equal side to side.
Okay.
And if we're not equal, something's getting more blood flow than the other side. So we want to see, is there a mild roadblock, moderate roadblock, or significant roadblock, even temperature-wise, side to side at every single level of the spine, and going from there.
I guess I didn't even think that the temperature would tell you that much, and in that localized of an area. That's really cool.
Yeah.
And I noticed you have kind of an analogy for it, and I'm sure that comes from having to work with kids. Because going to the doctor is always a scary thing.
I try to make it as much fun as possible, even for adults, too.
I was going to say, I freak out at stuff like that. I am always scared of going to get anything adjusted because I'm like, I've seen the videos, and what if they, oops, one time.
Yeah.
And now my neck doesn't work. So I fear all of that, but it sounds like you make it very easy.
There are plenty of times that I'm even taking care of kids and we're playing and they don't even know they're getting adjusted because we're just on the ground playing in the little kitchen set together, that kind of thing. Or one of the biggest things when parents come in, I right away make the comment, is it okay if we have a little fun in this healing process? Like, can we just be authentic and be ourselves? And it's like, I know I'm not perfect and I don't expect anyone else to be perfect. And how can we go on this journey together of making our lives better?
I imagine that's got to put a lot of parents at ease.
Yeah.
I mean, when you're bringing, my dad, if I had looked at my dad and said, oh yeah, I'm taking my kids to get chiropractic work, my dad probably would have laughed at me and said, kids don't need that. Kids bounce, they're fine, they'll get up, they'll walk, they'll do whatever they're going to do. And they run around so much, they sort themselves out, which I think is a mindset many of us grew up with. But you've chosen to kind of make that your focus, that, and you mentioned prenatal, moms. Talk a little bit more about why and what makes that unique.
Yeah, so I even like to think of it as, hey, a toddler is falling on the ground. How many times is it learning to walk? That's a part of life. You don't necessarily think much of it. And if you fell 10, 20, 30 times a day from even just your regular standing height on your butt would probably be pretty darn sore by the end of the day.
That is very true, yes.
Yeah, and so it's like, well, they have a diaper on, it's fine. You don't think anything of it. And even all those constant actions of falling, you can think of it as a little bit of a physical trauma to them. Yeah, they get up, they bounce, and they go and run and play. But also what is happening internally in their body, and how can we just help them meet those milestones quicker of, hey, we're crawling sooner, we're walking, we're able to do all of those fun things that you want to see throughout development. And often what we even notice is babies who get adjusted early on, yes, it helps the babies, but parents sometimes even more of, hey, we had a birth and we have this little baby, but this baby is not eating right, it's not sleeping. You talk about this colicky baby of, oh my goodness, am I ever going to get sleep as a mom? Am I doing this right? I don't know what I'm doing.
Right.
So here I am, desperate of how can I get this baby to settle down so that I'm not feeling like a failure, that I can, provide for this child. I know this child is okay, but right. I'm not trusting my own intuition.
That makes sense.
So even it's like when you care for this little child, again, there's no popping, cracking of the spine.
Right.
It's literally fingertip pressure. So like if you're checking the ripeness of an avocado or putting in a contact, but with specificity and knowing what we're exactly doing and how we're doing it in a specific manner, we're able to see a lot of great results for kiddos that, often might go from a colicky kid that you never get adjusted, never addressed there. Those tend to be kids who get a lot more of those ear infections. And then as they start to get a little bit older the kid never crawled, but they went straight to walking, so that should be fine. Like, I want my kid getting around quicker kind of thing.
Right.
But there's so much beauty in brain signals when you learn how to crawl. That's important for those kids. Normally will later on, if they never crawl, are less coordinated when it comes to throwing a ball or playing sports because their brain just never got proper signals.
Right. There's a process you got to go through.
Oh, absolutely. And then it's like if you never address things, you get to the classroom. Normally these kids are a little bit more jittery, behavior, that kind of thing, that are more things prevalent that you see showing up at that point.
I do want to remind everybody, of course, once again, this is a paid program. The advice and opinions expressed during the program are solely that of Generations Chiropractic of Wisconsin, not necessarily WBEV or Good Karma Brands. I see a note on here, and I think about this. You talked about colicky babies, and you have a note of gassy babies.
Yeah.
And luckily, I know my oldest is not listening right now, or she'd be very mad at me, as she is 19 currently. But there was a time when we first had her, and we didn't know it was gassiness, but she would cry, and we'd burp her, we'd do everything, but it just didn't seem to be enough.
Yep.
And we actually had recommendation from a pediatrician to do these kind of stretching exercises with the legs and everything, and and kind of elongating the body and kind of crunching her up a little bit to kind of move things around.
Absolutely.
And sure enough, she'd give a couple of toots. Suddenly she felt fine. Everything was great. And we were told after the fact, there are probably some things that weren't quite in alignment and some body stuff because you're packing a lot into that little package.
And it's not easy coming out of that when you come out of mom, too.
Right. And this is very early on for her. And they're like, and then what do? You bundle them up and you put them into a little ball. And if you think about it, if you lived your entire life in a little ball, it might be tough for you, too. And I imagine there's got to be a lot of little wake-up moments like that you share with parents.
Absolutely. One of the biggest things when you talk about pregnancy and then, you have a newborn, if you think of a pregnant mama, they have the baby inside of them and everything is warm and cozy and mom is protecting everything naturally in her belly.
Right.
And then you take this baby out, whether it becomes, a natural birth or through C-section or however this baby gets into the world. And then this is a cold, bright environment. Like, what are we supposed to be doing? And our goal with chiropractic is how can we get something that is in reality a stressful event for both mom and baby, the birth process, a happy stress that you're like, hey, we get a little baby now.
Right.
But take the stressful event and get it into that nice, warm safety event and safety feeling for the child. So birth itself is like, we're going into what we call the sympathetic state of what people like to call the fight or flight, or I'm going to go, go, go.
Right.
And then we want to get them into this parasympathetic state of called basically more of a rest and digest.
Okay.
What are babies supposed to do? Eat, sleep, poop, and be cute and cuddly.
Right.
So it's like we want to be able to help educate moms and families about how can we get everyone into that sense of safety. Even as a whole, we look at adults, anyone, technology is constantly putting us into some of that. Okay, I got to go, go, go. There's this next thing I got to do, and this next thing, and this next thing. And chiropractic is all about how can we find that balance between go, go, go and safety.
Well, I think about, kids are very good at mimicking the emotional patterns and nervousness of adults that they're around. So if you're constantly go, 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 and you're very pent up, I'm sure the kids mimic that as well. I see a note here where you talk about, emotional is a thing.
Yeah.
We don't always think of kids as emotional in the sense of like, they're either happy or they're sad, right? They're hungry or they're sleeping, very, very one set mind on things, but there's more to it than that.
Kids are so intuitive. Like, that is one of the things I love about kids and babies, and I was actually thinking, dogs are like
Right.
mini Pearl. It's like, and she intuitively knows that something is not happy with this baby, doesn't know why this toddler is unhappy. but they just pick up on so many of the dynamics around them. And they aren't necessarily at the age where they can express and even communicate what is going on that they're feeling and sensing and picking up on.
Right.
And they don't know how to express it, nor have they gotten the abilities to properly manage, assess, and express.
Now, you mentioned that you also do some stuff with prenatal. I'm assuming that's not doing adjustments on the baby prenatal, but helping out mom.
Correct. So it is that weird balance of we do not step into the realm of obstetrics at all. While we have seen so many beautiful relationships with how mom progresses through labor when we get around to labor. But there's a big thing when we talk about prenatal adjustments. I'm so okay, this is where I get very territorial of my pregnant mamas.
Yeah, no, by all means.
Very territorial. I'm like, not anyone should just be adjusting a pregnant mama. Just like no one should just be adjusting a baby and a kiddo.
Right.
Does everyone need chiropractic? I'm a firm believer, absolutely. And again, that's kind of what I was going to. There's a lot of different specialties, whether it's, again, nutrition, prenatal, pediatric. Again, I don't touch my own animal. You know,
Right.
Some people are so much better in sports. And yes, we get trained in a huge variety of things when it comes to chiropractic school.
Right.
And yes, you can adjust, different demographics. And how can you really grow your knowledge in a specific area? That's what my thought process is of, I want to be an absolute expert in this area and
Right.
serve the best I can in this way. So where were we kind of at?
Talking about adjusting pregnant moms.
Oh, pregnant mamas, cool. Okay, I got so passionate about everything else there.
You're good.
So yes, when it comes to pregnant mamas, I utilize the Webster technique. So this, I also like to think of an easy way to remember. My practice is on the corner of Warren and Webster. So Webster technique, super appropriate there.
I like it. Is there a Warren technique?
No, not that I know of.
Shoot, dang. All right.
But Webster is huge and was named for basically the chiropractor who had come up with this. And we're focusing on a bone, a muscle, and a ligament on the back side of the pelvis and the front side of the pelvis. So you have your physical bones, which is normally what you think chiropractic is all about, the bones.
Right.
But especially in pregnancy when your pelvis needs to completely expand and then, afterwards it's got to, basically shrink back and stabilize because
Right.
it's done a lot of expansion in a delivery process. So how do we look at the muscles? Are they too tight? Are they in a good balance? Are there ligaments that are pulling the pelvis out of whack? Because even when you're micro shift off in pregnant mamas, a baby is smart. They're not going to come through a canal that's way too small.
Right. That makes sense. And so now I'm thinking, okay, we've got kind of a breakdown of your demographic of clients. We got babies, we got young children, we've got mamas. I hate to say it, but does that get left out? Do we look at adults as well, like besides pregnant women?
Yeah, so I love to be able to take care of the entire family. I named the clinic generations because I love to see the multiple generations. So you can think of it as pregnant mama and baby. I have some families that come in 3 generations, all 3 of them come in at the same time. Like, I love taking care of that. And I love seeing it's like, okay, those who have seen the beautiful successes in their family, they want to bring in their kids and they've now grown up with us and then they see, their future kids coming in. Right. To me, it's completely important to get the entire family unit in for care. And my goal is to be able to make that affordable so everyone can be doing that because, again, we said kids can pick up on what's going on with the parents. Sure, awesome. Yes, let's focus on getting these kids adjusted, but they're still going to pick up on the stresses of the parents if the parents aren't getting any care.
That is very true.
So I'm like, yes, let's get everyone taken care of. And it's interesting when you have some dads that'll come in, it's like, take care of the wife, take care of the kids first, I'll be last. And then other people, I love that it's like, I'm not sure, I'm a little skeptical of this. I'll go through some of the initial visit stuff and see what it's all about and see, if I do trust you with my baby or if I do trust you with my wife and go from there.
That doesn't make sense. We're very protective, us dads, sometimes. Mm-hmm. I guess this is more of a question about, the things that need chiropractic to kind of help with them. Do you see from mom to children or dad to children, like similar things that they need chiropractic for? I think about, and I'm using some family members as a thought here. I know an entire family of people where around the dinner table, in the living room, in the car, whatever, everybody is doing this. Mm-hmm. And I think that's horrible for your posture. It's horrible for everything. And I imagine they all need the same adjustment. But do you see other stuff that might be kind of...
There can be some similarities in that. And again, some of it is, hey, are we just growing up with this pattern of, yeah, we all are here at the dinner table? Or, is it a thing of, nope, we're going to break the cycle for this kid and, they're going to spend more time, playing sports or whatever. But definitely what I find interesting is when some people come in saying, I've had like digestive issues, I've had inconsistencies with either constipation or diarrhea and, just IBS runs in the family. Everyone in the family has just had some bowel stuff that's weird. And like you can see some of those similarities, but then it's also so cool to break those patterns.
And it's interesting to think that that's something that could be fixed with a chiropractic visit. Because, again, I guess the misconception that we have, and you said you'd love to break those misconceptions, is, again, it's just about putting the bones in the right order again. And there is a relationship between all those parts.
Yeah, so biggest thing with chiropractic is we're really focusing on the nervous system and how the brain communicates to everything in the body. So you go brain down the spinal column all the way out to the nerves, and then you basically those nerves that tell, hey, little pinky toe, I'm going to grow, or, stomach digest food, or, yes, please, I want my heart to pump blood everywhere. And we're, again, looking at, are there roadblocks along that pathway there? So I will never say that, okay, chiropractic fixes and cures, whatever. But yes, let's help your body function optimally. Let's try to remove those roadblocks and help your body be more efficient at what it's doing.
Now, and a lot of times when I think about going to see a doctor of any sort, it's usually because there is a problem. But with chiropractic, that's something where you can do it as a continual maintenance thing.
And I am more along the lines of, I don't even like to think of it as, a lot of people will come in saying, hey, I'm feeling pain, I'm feeling discomfort of some sort. I want to look at it as what is right with you and how can we help you function even more optimally? What is well with you and how can we make that another step in the proper direction?
I like that phrasing. If my wife was listening, as soon as you said what is right with you, she said nothing really loud.
Sorry, I also joke that I'm not a marriage therapist because,
No.
there are some times that people are like, yeah, see, honey, I told you should have been coming in. I'm like, not my room.
Like, I'm just glad you're here now. I want to talk about some other stuff that you guys offer because it's not just chiropractic. I see a note here about infrared sauna, and I love saunas. I think saunas are great. What role does that play at the chiropractic office?
Yeah, so I added the infrared sauna. Basically, I'd done a big remodel in July. It was actually in the process of, I was here on the radio when we were doing the remodel, so that timing worked out great. I want to be able to create a health and wellness opportunity for everyone in the community. And I know, hey, at the Y that there's a sauna, but I didn't know of any infrared saunas here at this time when I added that in all of Dodge County. I didn't know of any. Maybe I wasn't doing my research. I don't know. It could be either way. But I'm I see a need for this because there's so much value when it comes to even detoxification. And it's hey, we're just living in a world full of a lot of different, pardon me, a lot of different things going on that it's okay, they can be even great for helping with pain relief and relaxation and weight loss and anti-aging. We have preset programs on our sauna that can help with all of these things. The difference between an infrared sauna and what you sometimes think of as that steam sauna that'll go all around you is there's deeper levels of cellular healing, so even core levels of healing. So what I think is really cool about it is also you don't have to crank the temperature up as high. So yes, you will definitely still sweat too, but you can, again, at a lower temperature, get a deeper level. When you even sweat, it's 7 times more detoxifying than a regular sweat process through an infrared sauna.
Now, not being as hot has got to be nice too, because I know there are people out there where they have health conditions that are sensitive to being overheated.
And there's always, again, just like with chiropractic use of an infrared sauna, hey, there are times when this is better for people or not. If you've had certain kinds of joint replacements, hey, it may not be best to heat up your body at all, different things like that. So it's, no, not just anyone can walk in off the street of, yo, I hear you have an infrared sauna, let's go. No, you still have to go through intake paperwork. We still want to make sure things are clear, that kind of way. But you also don't have to be a practice member to utilize the sauna too. I have some people who come in and it's nope, I get chiropractic care elsewhere, or dude, this is not for me. And I'm so passionate that I'm everyone needs and deserves chiropractic care. And I'm never going to be sitting here trying to shove this down your throat because I want to be able to help educate and provide information. And I'm not going to waste my energy if you're not open to it. People are open to it at different times in their life.
So if people want to come in and just say hi to Minnie Pearl and hit the sauna, they can definitely come in and fill out some paperwork and do that.
Absolutely.
That is really awesome. I see a note here, and I love this because it's the perfect time of year, and I think about how cold it is outside right now. and I'm thinking, boy, I wish I had a sauna to climb into just to warm up. But it does have some health benefits, especially in the winter.
Absolutely. So whether it's winter, whether it's, again, people normally talk about a spring or fall detox, and normally huge things there, but immunity benefits, especially depending on the different settings. So you're, again, helping detoxify all those ickiness, grossness out of your body. Again, I love technical terms of ickiness, grossness. So,
I get it. Those work.
Hey, when you work with toddlers and babies, like
you're working with one right now, so I get it. Yeah.
I was gonna say, give yourself a little more credit.
All right. Well, maybe slightly more than toddler, middle schooler at best.
Okay. Still working through those puberty unsureness of different times.
Every now and then the voice still cracks. Absolutely.
Fair enough.
So that it could definitely help with those detoxes.
Absolutely. So again, just so many things of there are other ways to just to be supporting your immune system. I adjust so many sinuses this time of the year. People are like, you can adjust your sinuses?
Yeah, you kind of just perked my ears up on that. That's a thing?
Yeah. So again, they're your facial bone. So you're not going to hear popping, cracking, but I often utilize sometimes called the clicker or this drop table component, and it helps basically open them up. Things drain a little bit more. You have that weird balance. Oftentimes people are like, okay, I walk outside in the cold, then I come back inside and everything immediately is draining. And other people are like, things are just so stuffy because of the dry air.
Right.
So sometimes, again, you just need better signals even to your sinuses. And how are other ways that we can support your body and help you do well in this time of year?
And that doesn't require the weird thing is where they stick a balloon up your nose and inflate it or any of that weird stuff.
Some chiropractors do that, but no, I do not.
Every time I see that, it just makes me shudder. So I guess I got to ask, because when I think about chiropractic, I think about necks, shoulders, maybe hips, back. Now you're adding nose. Are there any is there chiropractic for ears? Is there chiropractic for individual fingers? Is there any part of our body that doesn't potentially have some sort of benefit from chiropractic?
This is my own bias, but I can't think of anything that wouldn't. Again, we want to look at those brain signals going everywhere in the body. I mean, I do adjust ears, especially when it comes to toddlers and ear infections. I adjust those. I, adjusted some toes yesterday, and people are like, wait, well, how does that? I'm not saying I do all, especially different extremities or, some of those fingers, toes, knees. That's not my area that I'm like, I'll adjust them. Again, other people specialize in some of those things. That's not my main specialty. I'll adjust them when needed. And but there's so many benefits of starting with the spine and working your way out and then going from there to live your best life.
I imagine it's got to be kind of somewhat fulfilling to go to work and get to work with, especially, babies. They're just cute. They got the tiniest little toes, tiniest little everything. And to just get to kind of play with them, but also provide a healthy service for them.
And then you get to return them too.
That is a really nice benefit too.
Yeah.
I like that. I like that a lot.
And I love to hear when parents are like, they slept great at night and we were able to get some rest. And I can tell my baby is just feeling more comfortable in their own skin. That's what really warms my heart is when the parents are seeing that. They're like, oh, yes, this baby can sleep.
That is really, really nice. I have so many questions just bouncing around in my head right now. And I want to dive a little bit more into the chiropractic work. Walk me through a typical, if I'm a new client and I come reach out to you and Dr. Ellie, I want to come in, I want to bring in, my son or daughter, just to kind of have you look them over, whatever the case may be. What's that process like? I mean, is there a 6-week waiting period? Is there, I guess I have also. Yeah. How does it work?
Some of it all depends on what is your availability, what is my availability. We know that's how life works.
Right.
Normally after 5 p.m. is normally pretty full in the clinic. Afternoons are definitely more full because people are coming in after school. I do like to have that morning option, so I have some people that actually come in before school or work first thing too. So I like to be super adaptable. For example, I actually gotten off the phone with some people this morning that I'd done their history and their history of what was birth, pregnancy, that kind of thing, for a 2-year-old and a 4-year-old. Well, mom is at home with the kiddo so that next week, Monday, when they come into the clinic, we can do all the exam stuff and we don't have to sit there, talking with mom as much as, hey, they want to just kind of run around and play. So sometimes it's easier to manage in that sense. But typically when someone reaches out, I like to, without a doubt, get them in within the next week. Normally I can still get them in that same week. First visit is normally 45 minutes to 60 minutes, and I like to think of it as more of a fact-finding day of Hey, what's going on with your history? What can we find out? Where's our baseline at? How can we measure where your functioning is at right now? So that the second visit, we can come and talk, and normally that one can easily be a half an hour to an hour of, hey, here are the results. How can we get you reaching the goals that you want to be thriving? And this is what a game plan is like. I'll always provide what I think are the best recommendations and support someone in their journey. There are some chiropractors that are like, it's all or none. And I'm like, it may not be the best season of your life to be all in 100% right now, but knowing that you need some care, and I want to be able to provide that in the process.
When it comes to setting goals, especially for babies or toddlers who maybe can't really express, in the same articulate way that we as adults can. Not that I'm doing a great job right now. When it comes to expressing those goals, it's really difficult for them. How do you help with kind of setting those goals? What do goals look like?
Well, normally there's a reason why parents are bringing the kids in for the first time anyway. So sometimes it's like, yes, hey, they've grown up with chiropractic and we know this is going to just be a beautiful thing for wellness. And then a lot of it is, let's just basically maintain this wellness.
Right. That's the easy way.
Absolutely. And then there's other times it's like, my baby just seems fussy and I don't know why. So normally, hey, we really only have to set that one goal of, we want the baby to be able to sleep. We want mom to be able to sleep. So again, it just depends on where are things at, or if we're coming into the clinic and my child is 1.5 years, 2 years old and we aren't really walking yet, or we aren't crawling. People mentally have that idea of, I want my child to be doing this, or my child should be doing this, or they aren't keeping up with their peers. So you kind of have an idea of, okay, what you think the baseline should be, or what other people at their age are doing. You're like, I want that for my child. And
we do know that parents love to compare where their kids are at similar ages. So that's got to be a great indicator for them of what seems normal. Mm-hmm. And then they can come in to see you and kind of make sure things are progressing the way they should be.
And then I also like to think of it as how I talked about that technology that I incorporate. I like to think, okay.
Race car.
Yes, race car. There's, other kids, older kids will sometimes do the muscle stuff, not normally until they're older. But yeah, some of that. And there's also one that's more of like in either an ear clip or a finger clip, kind of measuring their overall long-term resilience and how much do they switch from that go to that chilling out state.
I like that.
And what I like to think of it is a combination of, hey, that's a third of the kind of the type of recommendations, being able to get that functional measurement of what data is saying. A third is what are either parents or patients or, depending on their age, what are they experiencing? And then a third is, what am I noticing shifting in their bodies visit to visit too? And how can we take all three realms and be like, this is where we're making progress, or this is where we could use a little more work, or yeah, sometimes not all things will match up of, hey, I'm feeling great in my body, but I'm still seeing those same old patterns showing up, or technology isn't necessarily saying things are changing, but there are other times that it's like, I'm not sure if I'm feeling anything. Is this making any differences? But then we notice that it shifts in what data is saying and what I'm feeling visit to visit. And hey, sometimes it's, again, working through that journey. So we figure out how is everything meshing to create a good plan to get you doing better.
And I think that kind of dispels another myth about chiropractic. It's not always immediate, problem is solved, everything's fixed, you're good to go, never have to see you again. Sometimes the journey is a longer one. It takes a little patience.
Absolutely. And normally I'll end up finding a lot of people that want to go into maintenance care and, again, emphasizing that wellness type component of, hey, I love when people are coming in, I'm doing great, not feeling any achiness and maybe a little bit of stiffness. I think I maybe slept wrong, but it's not that, oh, this is shooting down my arm and I can't even lift my arm. Like, those are not nearly as much fun as, hey, we got you past that shoulder pain and now you're seeing everything else that you're like, I didn't even realize this could be improved. And sometimes those are the more fun things, but that they obviously take longer to get to those results.
That makes a lot of sense. Unfortunately, we're reaching the end of the show, so we're running out of time for me to ask you more questions.
Yeah, don't worry. I'll let you pester more questions in the future.
Perfect. I love it. I do want to remind everybody, of course, that if they're looking for, and I'm in a note of this, that health and wellness opportunity, they can come find you 105 Warren Street, Suite 1 here in Beaver Dam. Local, which is nice. Doing pediatric, prenatal, and family chiropractic. The phone number, again, we have 920-885-0641. Call or text, but texting is easier, and I can definitely agree with that. They can also find you online and book online as well, generationschiropracticwi.com. I just want to take time again to thank you for coming on the show.
Yeah.
Dr. Ellie. This is just how I'm going to refer to you from now on, as Dr. Ellie.
Oh, yeah, that's so much easier.
I'm just a big kid anyways. But, of course, Dr. Ellie, or Elizabeth Kinsey, if you will, here in Beaver Dam. Any final words you want to say to anybody?
I'm just excited for the opportunity to be able to help educate on chiropractic and continue to work on debunking different myths that people aren't aware of.
We're definitely excited to help you do that. And again, thank you so much for coming on the show today.
Yes, I appreciate it. Thank you so much.
This has been a paid program. The advice and opinions expressed during the program are solely that of Generations Chiropractic of Wisconsin, not necessarily WBEV and Good Karma Brands.